Good afternoon, everyone. Wherever you are watching this from, I hope you're doing well. Welcome to the special mental health virtual event. You Matter, Tara, Usap Tayo, in celebration of the third anniversary of the mental health law. We have a jam-packed event for you today, filled with messages from the key legislative champions of the mental health law, as well as mental health frontliners who have spearheaded telemental health in the Philippines, and of course, mental health youth advocates who have run grassroots organizations to further mental health support, both in the digital space and in communities. Later on, we will be joined live by representatives of our implementing agencies of the mental health law from the Department of Education, Department of Labor and Employment, the Philippine Health Insurance Corporation, and Department of Health for an open forum wherein they will be answering questions regarding the current efforts for mental health in the Philippines and what that means for Filipinos. We have so much to look forward to in the next hour and a half, but before anything, let us take a few moments to take a step back, recenter, and practice mindfulness through this grounding video.
Humanap ng isang komportableng pwesto. Dahan-dahang ipikit ang iyong mga mata at ilapag ang iyong mga kamay sa iyong tuhod. Ituon ang iyong atensyon sa pagkakadikit ng iyong katawan sa kung saan ka man nakaupo o nakasandal. Pakiramdaman ang bigat ng iyong katawan sa iyong inuupuan. Siguruhing tuwid ang iyong likod at komportable ka. Huminga na malalim. Inhale. Exhale. Inhale. Exhale. Habang patuloy kang humihinga ng malalim, i-relax ang iyong balikat, ang iyong tiyan, ang iyong mukha, ang iyong mga kamay, pababa sa iyong mga binti at paa. Bigyang pansin ang mga ito at dahan-dahang bitawan ang anumang tensyon. Ngayon, muling ituon ang iyong atensyon sa iyong paghinga. Obserbahan kung paanong dumadaloy ang hangin papasok sa iyong ilong, papunta sa iyong lalamunan, patungo sa baga, at palabas muli sa iyong ilong. Bigyang pansin ang bahagyang pag-angat at paglubog ng iyong dibdib at tiyan sa bawat inhale at exhale. At subukang gawing natural lamang ang paghinga at mag-relax. Ngayon, pagtuunan ng pansin ang pakiramdam ng iyong paghinga sa iyong ilong. Pakiramdaman ang iyong hininga habang ito'y pumapasok at lumalabas. Mag-focus lang sa pakiramdam na ito sa tuwing paghinga at paglabas ng hininga. Maaari mong mapansin na malamig ang hanging pumapasok sa iyong ilong at mas mainit naman ang lumalabas na hininga. Kapag napaisip sa ibang mga bagay o kung may mga bagay man na nakaka-distract sa iyo ngayon, bigyang pansin lang na ito'y mga naiisip mo lamang at bahagyang ibalik ang iyong atensyon sa iyong paghinga at huminga ng malalim at ilabas. Pansinin ang unti-unting paghinahon ng iyong katawan. Pagtuunan ng pansin ang iyong paghinga at payagang dumaan ang mga ibang laman ng isipan at mga nararamdaman habang tuloy-tuloy ang paghinga. At kung ika'y handa na, ibalik ang iyong atensyon sa pagkakadikit ng iyong katawan sa iyong inuupuan o sinasandalan at dahan-dahang imulat ang iyong mga mata.
The practice of mindfulness has been found to be beneficial in dealing with stress and improving overall well-being. Simple mindfulness exercises, such as the one we just did, can be practiced anywhere and anytime. If you want to go back and use this video for your future practice, you may go to our Healthy Filipinas Facebook page or on our DOH YouTube channel. Now, moving on with the rest of our program, let me introduce the person delivering our opening remarks. She's the Concurrent Director for Health Promotion Bureau and Disease Prevention and Control Bureau at the Department of Health, Philippines. Immediately prior, she was Chief of the Research Division of the Health Policy Development and Planning Bureau, where her efforts significantly contributed to the passage of key legislation on sugar-sweetened beverage tax, tobacco tax, and universal healthcare. Currently, she is also the Special Assistant to the Secretary of Health for Universal Health Coverage, where she serves as a policy advisor for the implementation of UHC and the alignment of policies between DOH and PhilHealth. Ladies and gentlemen, Dr. Beverly Lorraine Siho.
Good afternoon to everyone present here today and viewing from home. I would like to begin by welcoming you all to this mental health virtual event. You Matter, Tara, Usap Tayo, in celebration of the 3rd anniversary of the Mental Health Law. The Mental Health Act is a monumental piece of legislation that came to be through years of advocacy, research, and multi-sectoral effort to put mental health on the map as among the foremost issues in the country. Leading up to this moment, there have been many achievements for mental health in the country, such as the establishment of setting specific standards and guidelines to support the overall well-being of Filipinos, as well as the continuous effort for mental health research and system strengthening to make mental health more accessible to all Filipinos. The dream of a healthy Pilipinas, both physically and mentally, is not one that we can attain solely on our own. We know that it will take a whole of government and a whole of society to promote and enable the realization of this in our schools, in our workplaces, and in our communities. Kaya naman, just as we did in this pandemic, we must come together to ensure that we continuously work to provide a supportive environment where Filipinos are valued and empowered to live their healthiest lives. Today, you will be hearing from representatives of various sectors that we work with who have championed mental health in their own ways in support of achieving a healthy Pilipinas in their own spaces, be it through legislation, advocacy, or service delivery. We hope that through this virtual event, you will learn more about why we must further promote and invest in mental health and safe spaces, as well as make mental health available and support the services that are available to you.
Thank you, Dr. Beverly, for opening up our event this afternoon with that inspirational message. Truly, we all have a role in promoting mental health and safer spaces in schools, workplaces, and communities. As mentioned earlier, so much has happened in the last 3 years for mental health since the passing of the mental health law. So moving forward, let's take a brief peek at some of the highlights for mental health in the Philippines since 2018 through this Don't Blink video. So get ready because you don't want to miss it. Wow, what a moment in time to be in, and to think we are just getting started. These accomplishments can be attributed not only to one sole entity, but to a network of champions who have been working tirelessly towards our shared goal of a mentally healthier Philippines. Now, it is time for us to hear from the legislative champions of the mental health law and the universal healthcare law on championing mental health legislation and the investment case for mental health in the Philippines. Our first speaker championed laws that improve healthcare services throughout the country. He co-authored and co-sponsored the Universal Healthcare Law, which not only provides healthcare coverage to all Filipinos, but also expands available PhilHealth packages to cover free checkups and laboratory tests. Here to give a few words to start off our event, Senator Juan Edgardo Sonny Angara.
Hello po, greetings to all the viewers of today's online event on mental health sponsored by the DOH. 3 taon na po mula nung ginawa po natin yung mental health law kasama ng ating mga kasamahan sa Kongreso, yung Republic Act 11036. Ito ay isang positive step dahil kinilala po yung kahalagahan ng pagtrato or pag-treat ng mental health at di natin nasabi na ngayon under the pandemic talagang kakailanganin po yung mental health services. So pasalamat po tayo sa National Center for Mental Health for having the hotline. Marami pong natutulungan yan at sana 24 hours magkaroon tayo ng ganong klaseng 24-hour hotline na always available po dahil minsan yan lang talagang kailangan ng ating mga kababayan. So I wish you luck and let us know how else we can help, be of assistance in this time. Talagang mahirap, magtulungan po tayo, maging mapait po tayo sa isa't isa, intindihin po natin ang bawat isa. Ingat po, God bless, mabuhay.
Thank you, Senator Angara, for that message. Our next speaker became the author and sponsor of 9 out of 14 Senate bills that passed into law in the 18th Congress. As the chair of the Senate Committee on Health, he authored the Malasakit Centers Act and pushed for the passage of the Bayanihan to Heal as One Act and the Bayanihan to Recover as One Act amidst the COVID-19 pandemic. He also championed other legislative measures and aimed at improving our healthcare system. Here to talk more about the pledged support of the government to safeguard the mental health of Filipinos, Senator Christopher Lawrence Bongo.
Maligayang pagbati po sa lahat ng nandito ngayon sa ating mental health virtual event na You Matter, Tara, Usap Tayo. Isang realidad po na marami sa ating mga kababayan ang apektado dahil sa mga problemang dulot ng COVID-19 at isa sa mga suliranin na di masyadong nabibigyan ng pansin sa panahong ito ay ang ating mental health. I believe that this should not be the case. The anxiety and uncertainty caused by our present circumstances are as serious as the disease itself, and its effect may linger on after we overcome this pandemic. Ang ating mga saloobin, emosyon at pag-uugali ay mahalagang bahagi po ng ating kalusugan. Kaya dapat lamang natutukan at bigyang halaga at pansin natin ang mga ito patuloy nating paglaban sa pandemya. That is why I am very happy to have our dedicated mental health professionals as our partners in looking after the well-being of our citizenry. I am likewise glad that we are holding this event to shed light on the mental health problems that are brought about by the COVID-19 pandemic. Maraming salamat po na nariyan kayo at lagi naming maasahan. As a senator, I assure you that the government will do its best to ensure that all forms of psychosocial assistance will be made available to our people, especially those who are suffering from any form of mental health issues. Kasama ninyo po akong makakausap at maasahan lalo na sa panahong ito. Gagawin ko po ang lahat ng aking makakaya upang lalong mabibigyan ng pansin ang problemang ito. Asahan din po ninyo na patuloy kong isusulong ang mga programa, panukala at inisyatibo na makakatulong sa mental health ng ating kapwa Pilipino. Maraming salamat po at mabuhay kayong lahat.
Maraming salamat, Senator Bongo, para sa inyong mensahe. At saka salamat rin po sa lahat ng suporta na binibigay niyo sa amin, sa Department of Health, at saka po sa lahat ng mga polisiya natin rin po na pinapalabas para isuporta ang health at saka mental health po na para sa lahat. So, our next speaker is a health and women's rights advocate, a proud activist, and a champion of the basic sectors. She is the Philippines' first social woman senator, and in her first term as senator, she passed 13 laws, including the Universal Healthcare Law and the Philippine Mental Health Law. Here to talk more about the importance of further strengthening the implementation of the mental health law, Senator Theresa Hontiveros.
Investments in healthcare were, along with the advocates, decided to embark on a campaign that states the obvious. There can be no health without mental health. And the rest, they say, is history. 3 years ago, we realized the dream of institutionalizing a national mental health policy to address the mental health needs of Filipinos. Through the passage of the Mental Health Act, the rights of every Filipino with mental health needs were protected and secured. There is hope that the stigma and discrimination that often accompany people who suffer from mental health issues will end. Since 2018, a new crisis hotline under the National Center for Mental Health was launched. The Labor Department also issued an order mandating that all workplaces and establishments craft a mental health workplace policy and programs to raise awareness and provide support for at-risk workers and those with mental health conditions. Advocacy activities such as the Public Health Convention on Mental Health, the observance of the World Health Day, World Suicide Prevention Day, National Mental Health Week, and mental health fairs were also conducted and observed. Just as programs and initiatives promoting the mental well-being of Filipinos commenced to fulfill the objectives of the mental health law, the COVID-19 pandemic, first reported in Wuhan, China, struck the world. And this pandemic, to a lesser or greater extent, has negatively affected the mental health of every person on the planet. Panahon ito ng stress, uncertainty, isolation at gutom. Marami ang napuwersang manatili sa bahay, napilitang mag-adjust sa bagong work-from-home setup, nawalan ng trabaho, nawalan ng kabuhayan, at nawalan ng kapamilya dahil sa COVID-19. The number of distress calls the NCMH hotline received significantly increased, almost doubled in the first quarter of this year compared to the same period in 2020. We need to strengthen the enforcement of the mental health law now more than ever. Last year, we flagged the alarmingly low 2021 budget allocation for mental health-related medicine. Mental health medication are one of the most expensive maintenance drugs. At alam nating marami ang mas pipiliin na gumastos para may pangkain o pantawid sa araw-araw. If we fail to subsidize these medicines and services, It can lead to even higher rates of suicide and other mental health related conditions. Patuloy tayong magbabantay, lalo pat papasok na naman ang budget season. Let's work hand in hand to ensure that adequate funds are appropriated to support our mental health programs. Kung hindi sasapat ang pondo, isa pang pandemya ang maaaring umusbong at lumaganap sa ating bansa. We can't let that happen. There should also be service capability upgrading for local mental health facilities in order to keep up with the evolving needs, especially at this time when addressing mental health concerns is as critical as any other physical health intervention. I am also hopeful that the Mental Health Division under the DOH will soon be created as mandated by the Mental Health Act. This is a crucial part of implementing the National Mental Health Program by the Mental Health Council. Let us always go back to the very heart of this revolutionary law. There can be no health without mental health. Thank you very much.
Thank you, Senator Theresa, for that message. And thank you so much for all the support that you have done for mental health. And you are right, we need to work together in order to further mental health support, services, and make healthier communities. So for our next speaker, she is the duly elected representative of the 2nd District of Marikina City and Deputy Minority Leader of the 18th Philippine Congress. She's an academician who served as a professor and development department chair of the University of the Philippines School of Economics. She also has an extensive research portfolio in the field of health economics, industrial organization, microeconomics, education, poverty, and public policy and regulation. Here to talk more about the investment case for mental health in the Philippines, Representative Stella Luz Alabastro Kimbo.
Magandang umaga sa lahat. Isang malaking karangalan na kasama ako sa pagdiwang ng Department of Health ng ikatlong anibersaryo na pagsasabatas ng Mental Health Act. The DOH has been at the forefront of ensuring that good mental health and well-being is a right enjoyed by all, and I truly appreciate the efforts it has made and will continue to make. Bilang isang guro at ina, dama ko ang mga posibleng pinagdadaanan na mental health issues ng mga kabataan. Higit pa rito, marami ng pagsusuri na nagpakita ng issue sa mental health ay pinagdaraanan ng maraming mga Pilipino sa kani-kanilang pamilya, pag-aaral o trabaho. Tulad ng COVID, walang pinipili ang mental health issues, mahirap man o mayaman ay pwedeng magkaroon nito. Unfortunately, the pandemic only exacerbated the current situation. PSA reports that in the past year, the suicide rate in the country increased by 25% alongside 3,529 recorded cases of self-harm. In addition to these, it is important to acknowledge that mental health issues can manifest much earlier and in less obvious ways, whether it is from conditions such as depression and anxiety, or from the sheer exhaustion and uncertainty that comes with everyday life with COVID. The youth are increasingly vulnerable. Not only do they have to cope with prolonged community restrictions, they also painstakingly have to deal with the difficulties of online education. Their increased and more prolonged exposure to social media is also a source of risk of mental health issues such as the so-called Facebook envy o yung inggit na nararamdaman kapag nakakakita ng mga post at nakakalimutan yung expectation versus reality na aspeto ng social media. Dahil dito, ang mental health ay dapat na pag-uusapan at meron dapat mga serbisyong nakakatulong para ito'y maibsan at higit sa lahat, may sapat na pondo para suportahan ang mga ito. The fundamental right to good mental health is the driving force behind the Mental Health Act, which was enacted in 2018. Sa pamamagitan ng batas na ito, responsibilidad ng gobyernong siguruhin na may epektibo at abot-kayang mental health services sa ating mga healthcare facility paaralan, opisina at pamayanan. Maliban dito, nilalayon rin ng batas na magkaroon ng komprehensibong information campaign upang ipalaganap ang halaga ng mental health at ng pagsusulong ng mga programang makakatulong dito. We have made significant strides in promoting mental health and providing much-needed services and programs. However, we must also acknowledge that there is still much to be done. Hindi sapat na sabihin sa isang tao na lilipas din ang iyong problema. Kailangan natin ng mga epektibong programa na naghahatid ng serbisyo. Una, kailangan nating patuloy na bigyan ng pondo ang ating mga mental health-related programs. Despite the passing of the Mental Health Act, data show that the prioritization of mental health funding remains low. In the proposed 2021 national budget, only 615.5 million pesos was originally allocated towards the mental health program, which comes out to only about 6 pesos per Filipino. Hence, with Representative Bongo, I filed House Resolution number 1225 last year to augment the budget for mental health by 1 billion pesos. This bore some fruit as the mental health budget was increased by 100 million pesos in the 2021 GAA after our calls. Rest assured, sufficient funding for mental health is something that I will continue to fight for. Napaka-importante na ang mga salita at pangako natin ay may kaakibat na aksyon. Kaya patuloy kong sisiguraduhin na makakuha ng ating National Mental Health Program ang kailangan nitong pondo sa darating na budget deliberation. Dapat din mas tutukan ang implementation ng mga proyekto sa ilalim ng ating mga mental health program at mapag-aralan natin kung paano natin mas mapabubuti ang mga ito. One of the key provisions in the Mental Health Act is the creation of a mental health division under the DOH. This division is instrumental not only in overseeing the implementation of our national mental health program, but also in monitoring and evaluation towards improving the program down the line. Dapat data-driven at evidence-based ang ating pagsusuri sa mga proyektong ito upang sigurado tayo na masasagot nito ang pangangailangan ng mga tao. The recent creation of this division could not come at a better time, and we eagerly await the strides it will make towards better mental health for Filipinos. Government must continue to take the lead in advancing good mental health and well-being, recognizing that advancing mental health requires a whole-of-society approach. As mentioned in the Mental Health Act, agencies like DepEd, CHED, and TESDA must work towards both effectively integrating the topic of mental health in the curriculum, as well as providing professional and accessible mental health services for students. As head of the Technical Working Group and co-author of the Basic Education Mental Health and Well-Being Promotion Act, I believe that closing the gap in our educational institutions by hiring a sufficient number of mental health personnel, such as guidance counselors, is instrumental towards good mental health and well-being for our students. Likewise, CHR must be given the appropriate resources to fulfill its investigative role against violations of civil and political rights, acknowledging the intrinsic relationship between upholding these social rights and promoting mental health and well-being. DOLE must lead in proposing office mental health programs and in getting rid of the stigma and discrimination that comes with discussing mental health in the workplace. LGUs must continue to coordinate with community health and social workers to provide appropriate and contextualized mental health facilities and services for their respective communities. Ngayong panahon ng pandemya, marami na tayong pagsubok na hinarap, kasama dito ang krisis ng nalulugmok na mental health ng mga Pilipino. Through the continued support towards effective implementation for the Mental Health Act in the years to come, and through the continued action of partners in the public sector and beyond it, there is hope that not only will we recover from this current crisis, but that we will build better and think better.
Maraming salamat sa continued support nyo sa aming mental health program po, Representative Kimbo. At tuloy-tuloy natin, we'll work together to build healthier communities, both mentally and physically. So our next speaker is a prolific and dynamic lady legislator that is known as a staunch advocate of public health. Her legislative agenda includes reforms in the health sector and the provision of essential social services for Filipinos, such as education and livelihood. Among the most notable legislations to her credit include Republic Act 11223 or the Universal Healthcare Act. Here to deliver the final words from our legislative champions, Representative Angelina Helentan.
As one of the principal authors of UHC Law and advocate of Mental Health Act, I am pleased to note that we are making significant progress in the integration of mental health care in the basic health services. Under these laws, the government is required to provide health services down to barangay level and increase the capacities of healthcare workers. For almost 3 years, since the Mental Health Act was enacted into law, we recognize the importance of the legislations and its prompt operationalization, especially during the health crisis like the COVID-19 pandemic. In response to the growing concern of many sectors on the spiraling cases of mental health problems, the Committee on Health conducted a hearing to deliberate on my privileged speech, which seeks to look into the status of the implementation of the Mental Health Act, particularly on the provision of mental health services to our young people. In that meeting, I have called on concerned agencies of the government to facilitate the scaling up of mental health services in the face of reported spikes in mental health-related cases after the imposition of community quarantines due to COVID-19. I have specifically asked the Department of Health, together with the Commission on Higher Education, Department of Education, and local government units to buckle down and waste no time in spearheading the operations of community-based mental health care services or facilities in all provinces, cities, and municipalities by creating a responsive and evidence-based mental health programs and policies, including mechanisms for suicide intervention, prevention, and response strategies. I welcome the Department of Health's initiative on coming up with a timely standards and guidelines for setting up a community-based mental health program. Let me reiterate my call on all local government units and academic institutions to forge stronger ties with concerned government agencies, private sectors, and other stakeholders in fast-tracking the provision of responsive community-based mental health services throughout the country, even as we face the continuing challenges of COVID-19.
Maraming salamat sa mensahe ninyo, Representative Helentan. And thank you to all our legislators, our legislative champions for shedding some light on the updates regarding the Mental Health Act as well as UHC because they work hand in hand naman talaga po. And also, as we approach budget season, hopefully we continue to invest more in mental health because there's still so much work to be done, as mentioned earlier. So the COVID-19 pandemic has greatly affected the mental health of Filipinos more than ever. Telemental health has been bridging the support to where and when it is needed the most. Our next speaker is a telemental health service provider and champion for mental health system strengthening. He is here to talk about how innovations in telemental health will bring mental health support closer to the Filipino people. Ladies and gentlemen, Dr. Bernard Argosa from the National Center of Mental Health Crisis Hotline.
A pleasant good afternoon to everybody. During the initial years of my training as a psychiatrist, I have always been told by our mentors of the struggles that they've had trying to come up with an enabling law that would support and further the cause of mental health in the country. In fact, decades have passed, and that dream of having such an important piece of legislation remained all but an elusive one for everyone until this administration. I was fortunate enough to be a part of the preliminary work through the Mental Health Summit, and what we thought was an impossible dream became a fruitful reality as the mental health law was finally signed last 2018 by President Rodrigo Roa Duterte. The passage of the landmark Republic Act 11036, or the Mental Health Law, has created a great degree of challenges for the Department of Health and the National Center for Mental Health. Being the DOH flagship hospital in the country, the said act has not just singled out NCMH, the premier observatory center for research and development, but also the chief implementer of mental health programs with the goal of promoting health through education, capacitation, and other innovations that will promote the physical and mental well-being. Hence, the birth of the 24/7 NCMH Crisis Hotline. Since its establishment, the hotline has paved the way for hundreds of Filipinos to have access to a crisis line to address their mental health needs. In addition, the advent of the COVID-19 pandemic has affected a lot of our countrymen, which led to a staggering surge in our calls from a mere 350 callers per month during the first few months of the hotline's operations to an average of 1,000 callers during the first weeks of the first lockdown last March 2020. 1 year after, we have recorded the highest volume of callers at 1,600 in a month. From its birth last May 2, 2019, up to the present time, we have received a total of more than 20,000 calls. During the initial months of the lockdown, a COVID-19 hotline was also set up at the NCMH with a total of more than 2,500 clients served, especially those experiencing anxiety and depressive symptoms to the COVID-19 virus. Furthermore, we have elevated the services of the crisis line with our telemental health system. This is an online platform handled by competent psychiatrists and psychologists to better address the special concerns of our clients. It has recorded a total of 1,800 clients since its operations last March of 2020. And we have also partnered with the Philippine Guidance and Counseling Association to address the sudden surge of clients brought about by the pandemic. Despite the challenges, we at the NCMH, through its Wellness Center and Crisis Center, believe that there is always a better way of doing things. As we celebrate 2 years of giving the NCMH brand of mental health service, our goal is to continue making our services better and responsive to the needs of the times. The COVID-19 pandemic is an era of uncertainty, which has contributed in the rising number of clients in need of support and assistance. Hence, I'm proud to inform everybody of the major changes happening at NCMH. Firstly, the Crisis Hotline's partnership with EPLDT is in the final stage of its completion. A call center type of system will soon be in place, wherein quality assurance and control will be secured and implemented for the benefit of our callers. Trainings have started for all our hotline responders, team leaders, and program managers to orient and acquaint them with the technicalities of the system. More importantly, each and every call can be reviewed and guided with the end of giving quality hotline intervention to each and every caller. Second, we are finalizing within the next few weeks an agreement with PLDT and Globe Philippines for a toll-free 1553 short number accessible via cellular phone using all networks nationwide. It will be shouldered by the NCMH with the help of the DOH in order to give a wider reach and coverage for all those in need of mental health support. Our newest innovation to address the gap when it comes to the need for psychological intervention such as therapy will be under the stage 3 of our hotline responding system. A list of accredited registered guidance counselors and clinical psychologists from the PGCA and PAP will be provided to clients who can afford the cost of therapy. For those who will be deemed unable to afford, the NCMH will be providing the necessary specialists for free through the said organizations. Given all the tasks necessary to fulfill the mandate of the mental health law, we of NCMH would like to express our sincerest gratitude to the Department of Health for the unwavering support, to the Department of Health through its Secretary, the Honorable Francisco Duque III, Yusek Maria Rosario Berhere, Yusek Mirna Cabotaje, and the whole of the Department of Health. Maraming salamat po sa patuloy ninyong suporta. Tangalan po ng aming Medical Center Chief, Dr. Noel P. Reyes, aming hepe ng Special Concerns at CMPS Hospital Service, Dr. Beverly Azucena, at ang buong pamilya ng National Center for Mental Health. Happy anniversary po sa ating lahat at mabuhay.
Thank you, Dr. Argosa, for those exciting updates on our much-needed telemental health services. We are definitely grateful for all our partners from different sectors for making these innovations possible. Definitely together, we'll be able to bridge the support towards those who need it the most. So our next speaker is the Chief Psychiatric Resident of the Vicente Soto Memorial Medical Center. He's here to talk about the center's initiatives in support of the regional crisis lines in the Philippines through the Tawag Paglaom Centro Bisaya and the necessity of infrastructural preparedness in times of crisis. Ladies and gentlemen, Dr. George Anata Jr.
Mayong hapon kaninyong tanan. Greetings from Vicente Soto Memorial Medical Center, Center for Behavioral Sciences. My name is Dr. George Mario Onyate Jr. I serve as Chief Psychiatric Resident at the center. As part of the Department of Health's thrust to highlight the problem of our country's mental health issues, I would like to share our initiatives on the regional crisis lines in the Philippines. Since 2015, Tawag Paglaom Centro Bisaya has been serving the Filipino people 24 hours a day, 7 days a week. Tawag Paglaom is a call-based suicide prevention and depression hotline that caters to callers nationwide without discrimination. With the assistance of our highly trained responders, callers are referred efficiently to support groups or to qualified mental health professionals. Rooted in humanity, the organization has served 4,000 calls to date and counting. Through its years of service, Tawag Paglaom Centro Bisaya has evolved not only as a hotline but provided other services as well, to include psychoeducation, mental health awareness, and health seminars on suicide prevention and depression. At the height of the COVID-19 pandemic, mental health services needed to adapt even further. Tawag Paglaom Centro Bisaya engaged into social media, and BSMMC's Center for Behavioral Sciences initiated its telepsychiatry initiative. Telepsychiatry involved using any forms of electronic communications to continue to provide services in spite of the restrictions of face-to-face encounters. Telepsychiatry at VSMMC CBS has been able to cater around 1,000 patients a month since the pandemic started. As the Center for Behavioral Sciences delved into telepsychiatry, Tawag Paglaom helped to engage and triage mental health patients, extending its helping hand even further. As the challenges of this pandemic continues to loom, our regional suicide hotline and our telepsychiatry stand willing and able at the forefront of this mental storm. One is glad to be of service. God bless and stay safe. Thank you.
Thank you, Dr. Anata, for taking the time to shed light on how our different telemental health services can work together to provide quality and immediate mental health services and support to those who need it. So, civil society, non-government, and youth organizations play an active and crucial role in catalyzing change. Thanks to countless groups and individuals, mental health advocacy has only gotten stronger through the years. Around the country, youth advocates act as agents of change in influencing policies, co-creating programs, and building communities. Our next speaker embodies just that. He's the co-founder and executive director for #MentalHealthPH, a non-stock, non-profit organization that aims to promote and protect mental health in the Philippines through social media and digital technology. Guided by their 3S framework, self, society, system, and 3O's approach, online, on ground, and onward, #MentalHealthPH aims to achieve a mentally healthy community. Here to talk more about the work that they have done and the resources that are available through their organization, please help me welcome Mr. Roy O Dahil.
Good afternoon, everyone. I am Roy Dahil, and I am the co-founder and executive director of #MentalHealthPH. Thank you so much, Department of Health, for inviting us to speak in this event. It is really a great honor for our organization to be given this space to be able to share our story. In 2016, together with Lawrence, Ives, Gilbert, and Annika, we co-founded #MentalHealthPH. #MentalHealthPH is a non-stock, non-profit organization that aims to promote and protect mental health in the Philippines. We bank on the idea of using social media to raise awareness and normalize conversations about mental health. Because after all, a lot of things could be made viral with the responsible use of this platform. Since then, #MentalHealthPH had three main focus areas. First is providing support for individuals to be able to help themselves and other people on their mental health. Second is support for society by raising awareness and normalizing conversations about mental health. And lastly, support for system by strengthening linkages among different sectors, emphasizing that mental health is everybody's business. Our campaign is guided by the 3S framework, the self, society, and system, and the 3O's approach, or the online, on-ground, and onward. We believe that mentally healthy community could only be achieved by taking into consideration the individual, the society, and the system or the policies that exist that protects mental health. And we do this by maximizing digital technology, complementing it with on-ground work, and collaborating with different organizations to ensure our campaigns are sustained. We use online platforms like Facebook to share digital content about mental health, infographics about self-care, especially during this pandemic, mental health success stories, and among others. We even develop a simple chatbot to help us triage people who needs help or those people who wants to help. We also had #UsapTayo, which is a regular Twitter conversation happening every 10, 20s, and 30s of the month from 7 p.m. to 8 p.m. to normalize conversation and discussions about mental health at magkaroon ng regularity at safe space para magtalakay ng mental health, may celebration man o wala. Bumuo rin kami ng website na may directory ng mga mental health facilities at clinics sa Pilipinas. Dahil natutunan namin na hirap ang community maghanap ng health facilities kung saan pwedeng humingi ng tulong sakaling nakakaranas na sila or may kakilala silang nakakaranas ng sakit sa lusog-isip. We recognize that online platforms may have limitations, so we complement it with on-ground activities. Prior to the pandemic, we conducted talks in schools, workplaces, and other strategic places that are less intimidating so everyone can speak freely about mental health and ask questions. Through the efforts of our volunteers and ambassadors, we're able to secure partnerships with national and international organizations. Locally, we're given the opportunity to sit in several consultations and RTDs with DOH, NCMH, and WHO-led initiatives. We're also one of the members of the Mental Health Innovation Network and the country lead convener of United for Global Mental Health. And quite recently, through the support from the United for Global Mental Health, we conducted the first mental health country planning meeting, joined by 20 plus non-government organizations all over the country. In this country planning meeting, we were able to invite organizations from different sectors and work together in developing campaigns for mental health in the Philippines. In this workshop, we also launched the Philippine Mental Health Community Manifesto, calling for sustained collective movement in championing mental health across self, society, and system. Allow me also to invite everyone here to support and sign our community manifesto. You can access the manifesto through the link shown. Having said those, I believe NGO and the government could and should work together, especially on these three key areas: inclusion, innovation, and collaboration. Inclusion. We believe there's nothing about us without us. Service users and members of vulnerable communities, among others, should be in the front and center in the decision-making of the government. Through the NGOs representing these sectors, we can give them a space in order for them to be heard and give insights on the real experiences in the ground. Second is innovation. We have learned, especially during this pandemic, the value of innovation and digital technology in providing equitable access to mental health services and information. I believe the government need not to reinvent the wheel, but rather must invest on existing research by different local NGOs and researchers who are already working on an innovation that could potentially improve the mental health of many Filipinos. And finally, collaboration. In the same way that we started recognizing that mental health is multifaceted, efforts should also be made to bring together all sectors, government, civil society, private institutions, academe, among others, to work together, share knowledge and resources, support each other towards a common goal, which is a mentally healthy community. Together, we have achieved milestones and made significant strides to turn our plans into actions. Ngunit marami pang kailangan gawin. Now more than ever, we need to put mental health in the front and center of our programs, plans, and value system. By coming together today, we're hopeful that we're advancing our vision to reality. We believe that government can't do this alone, and NGOs can't do this without their support. It will take us all. Yun lang, and salamat muli. Together, let's achieve a mentally healthy community.
Thank you, Roy, for running us through all of the good work that your organization does. And don't forget, if you want to access their resources or know more about their events, you can check mentalhealthph.org or follow them on social media, Mental Health PH. So now on to our next speaker. She is a young Filipino leader with 11 years of experience in youth participation, governance, and service. She serves as a national chairperson of Youth for Mental Health Coalition, Inc., a youth-led non-government volunteer organization whose main goal is to fight the stigma on mental health through policy intervention, public psychoeducation, collaborative engagement, and implementation of appropriate and sustainable community-based initiatives. Here to talk more about her work in her organization and the active role of the youth in mental health advocacy, please help me welcome Ms. Elliana Lagasca.
Ang araw po sa ating lahat. Ako po si Elliana, ang National Chairperson ng Youth for Mental Health Coalition. Isa po kaming samahan ng mga estudyante, kabataan, young professionals advocating for mental health here in the Philippines and really trying our best to end the stigma on mental health. At masaya ako na ngayong hapon ay nakasama kami sa ating talakayan patungkol sa kalusugang pangkaisipan at for recognizing na rin that the youth sector is actually a very valuable asset in forwarding the mental health advocacy. So I believe the speakers before me have already emphasized on what mental health actually is. But I want to, of course, give this very few points, and realizing our mental health. Na dapat alam natin na ang ating kalusugang pangkaisipan ay isang positibong component ng ating buhay. Kung saan lahat ng pangyayari sa ating paligid ay nakakaapekto sa ating mental health at ang ating estado ng kaginhawaan o estado ng kagalingan ay nakakaapekto sa performance natin sa lahat ng aspeto ng ating buhay. Kung kaya't, I'm very happy to actually give you 5 important points as to why youth participation is important in the mental health advocacy. Alright. So I made this to emphasize more on why the youth shall be there in forwarding the mental health advocacy. Kasi unang-una, the youth is a very diverse population. At bilang magkakaiba naman tayo with different challenges, yung mga pagsubok natin varying across the youth sector dahil yung ilan sa atin ay estudyante, yung ilan sa atin ay member of the workforce, yung iba sa atin ay merong pagsubok pagdating sa pamilya, sa ating mga relasyon, and the alike. Siyempre, itong mga danas natin na ito ay kinakailangan nating maiboses. No? At bakit kaya natin sila kinakailangan maboses? Para malaman natin kung ano nga ba yung mga particular na programa, particular na mga activities, at particular projects na dapat maisagawa upang ma-address ang ating mga concerns. Pangalawa, our population is numerous. Sa katunayan, I try to search in kung gaano karami ang percentage ng young people age 15 to 30 sa buong total population ng ating bansa. And I haven't seen an updated statistic yet, pero through the years, we are seeing that the young people, the youth sector is actually 30% or more of the Filipino population. So kung tutuusin, kung iisipin natin, makita natin sana yung 30 million plus young people, young Filipinos na mas nakakaalam sa patungkol sa kalusugang pangkaisipan, mas nakikita ang importansya ng kalusugang pangkaisipan at doing their best in creating mentally healthy spaces, then definitely we can see a change in our community. Dito sa ating bansa ay meron tayong stigma on mental health, may discriminatory acts against people with mental health conditions. And minsan nga, sinasabi pa ng iba na ang mental health challenges daw ay gawa-gawa lamang. Ngunit in our numbers as young people, we can change that particular perspective. We can do something even in the personal level that will ripple its effect and will radiate para mabago din natin yung perspektibo ng ating komunidad. Pangatlo, we have unique participation in digital space and movements. Kung makikita man natin, during this time of the pandemic, karamihan sa mga social movements na nakikita natin who are proactively doing a lot to address specific gaps ay galing sa youth sector. Kaya very proud talaga ako sa mga kabataang Pilipino dahil kahit marami tayong danas sa panahon na ito ay nakikialam tayo sa mga issue ng lipunan at gumagawa tayo ng ating contribution in actually creating positive change. And syempre, we are natives of the digital space, Mas marami ang techie sa young generations. Kaya, kumbaga, if we actually push for the mental health advocacy in the digital space, being responsible netizens, and of course, making more healthy, mentally healthy spaces in the digital platform, then makikita natin yung change in perspective ng karamihan. Pang-apat, yung techniques and strategies ng young people are very new and innovative. That's why we have to admit that we have particular lapses or merong mga lack sa advancement ng systems natin when it comes to mental health. That's why our new techniques and new strategies can be very much helpful in addressing those gaps. But of course, I'm not discrediting din naman the efforts that older generations have done before us. Because yung kanilang mga action din nung kabataan nila ay nag-lead to us having the RA 11036, which is a very good indication that every single time na may kabataan kapag gumalaw ay makakakita talaga ng pagbabago sa ating lipunan para sa mga susunod na henerasyon. And lastly, because we will harvest the fruits of proactive and progressive campaigns now. Kumbaga, magiging din tayo mga magulang, tatanda din tayo, at syempre, we will also feel yung pagbabago na nagawa natin, yung pagbabago na contribute natin in our society. And definitely, if we actually create better spaces and better systems for mental health at this time, we can see that the generations after us will also harvest that and create better, more forwarded, sustainable programs in the future for the next generation as well. So kumbaga, yung ating mga danas ngayon ay sobrang valid naman po at yung ating mga iba't ibang pagsubok, if we actually translate them into action, if yung ating mga realities and mga realidad, yung ating mga naintindihan sa itsura ng mental health sa panahon natin bilang kabataan kapag nagsama-sama tayo, we are in solidarity and creating better systems, information, research, programs, and community building, then definitely in the future, our young population and of course, our children will also harvest yung ating pagbabago na nagawa. Kung kaya't inaanyayahan ko po ang mga kabataan na talaga nga namang mag-invest tayo sa ating mental health. Maaaring gawin natin siya in a very personal level kung saan inaalagaan natin ang ating kalusugang pangkaisipan at ito naman po ay magre-reflect din sa ating mga relasyon sa ibang tao, sa ating pamilya, sa iba pa nating mahal sa buhay, sa ating lipunan. At syempre, mahalaga na rin na after natin i-cultivate yung pagiging yung pag-prioritize natin ng mental health sa ating sarili, gawin din natin siya in our society, better spaces for mental health. Because since we have less than 5,000 mental health professionals in the country, mahirap po talagang makakuha ng mga serbisyo ng ating specialists, dahil sobrang dami natin in population. And since mental health is actually a primary concern that we have to acknowledge, then it's also difficult for our very few mental health professionals to address the concerns of 110 million Filipinos, diba? So, unahin natin ang ating sarili, tapos yung ating immediate environment, and later on we will see the change that we want to see in this society. And I'm really hoping na kahit kung ano man, yung mga paghihirap na pinagdadaraanan natin ngayon, ay gumawa tayo ng mga kaparaanan kung paano natin sila makakayanan. Kaakibat ninyo, at talagang sama-sama natin talagang pagtatagumpayan ang mental health advocacy. Nandito lamang ang Youth for Mental Health Coalition para sa inyong mga concerns, katanungan, and syempre we also offer programs and projects, and we facilitate different mental health service delivery platforms for you. Maraming salamat po, and I'm hoping to see everyone prioritizing their mental health because we need to be really kind to ourselves in order for us to be kind to other people as well. Maraming salamat po at magkita-kita tayo sa susunod.
Thank you, Yana, for that great rundown of all the work that Youth for Mental Health does. Definitely organizations such as the Youth for Mental Health Coalition are not just a separate entity, but also partners that we have in regards to our advocacy. And that goes beyond communication, but also with implementing field work, doing research, and really co-creating policies, programs, and the like. So thank you so much for that. And truly, mental health is not just mental health care, but mental health is everywhere, and we must all do our share to make our spaces better for everyone. Now, before we move on to the next part of our session, let's take a moment to watch this mental health video explaining tips on how we can care for ourselves and care for others during this pandemic.
Alam mo na ba? Ang mental health ay isang mahalagang bahagi ng ating pangkabuuang kalusugan. Walang health kung walang mental health. Ayon nga sa World Health Organization, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. Ang mental health ay mahalaga sa ating pangkabuuan at individual na abilidad magtrabaho, mag-isip, makaramdam at mabuhay. Kaya naman ngayong panahon ng pandemya, huwag kalimutang pangalagaan ang ating mental health tulad ng pag-aalaga natin sa ating physical health. Ang self-care ay isa sa pinakamabisang paraan upang pangalagaan ang ating mental health. Ang simpleng pag-exercise o pagtutok sa ating mga hobbies ay isang paraan ng self-care. Care for yourself, bigyang oras ang sarili at mga bagay na nagbibigay sa'yo ng saya. Nagkakaroon ka na rin ba ng Zoom fatigue dahil sa meetings, O di kaya ay sa online class? Huwag kalimutang magpahinga. Importanteng maglaan ng break at ipahinga ang utak. Maglaro muna ng paboritong games. Malaking tulong ang breathing exercises sa pagpapakalma at para maibsan ang ating pakiramdam. Matuto ring mag-set ng boundaries para sa iyong work-life balance. Matutong irespeto ang work boundaries ng iyong mga katrabaho. Dahil sa pandemya ang ating kinakaharap, hindi mapigilan na tayo ay mapalayo sa ating mga mahal sa buhay. Ngunit hindi dapat maging hadlang ang distansya upang tayo ay mag-hashtag care for others. Nakumusta mo na ba sina lolo at lola this week? How about sina mama at papa? Mga kapatid, kaklase? Kung hindi pa, ang isang simpleng kumusta sa pamamagitan ng video or voice calls o text messages ay tiyak na makatutulong sa kanilang mental well-being. Care for others, ang isang malakas na support system, ay nakakatulong rin sa pagpapabuti ng ating mental health. Kung ikaw o sino man sa iyong kakilala ang nangangailangan na makipag-usap sa isang mental health professional, tumawag lamang sa mga numerong ito mula sa National Center for Mental Health. Ito ay libre lamang at kahit sino ay pwedeng tumawag. Ngayong panahon ng pandemya, hindi biro ang pinagdadaanan mo, kaya naman make sure to care for yourself and care for others para sa isang healthy Pilipinas.
Totoo talaga na walang biro ang pinagpagdaanan natin ngayong pandemya. Yan ay bakit kung kayo o meron kayong kakilala na kailangan ng tulong, please do not hesitate to visit your primary care provider or call the National Toll-Free Crisis Hotline of NCMH 1553 or your regional crisis hotline. Because you matter, so tara, usap tayo. So we are now at the second part of our event today. I would like to recognize Glenn from the Communications Management Unit to facilitate the open forum together with our panelists.
Good afternoon once again to all of our participants who are joining us in the celebration of the third anniversary of the Mental Health Law online. We have heard from our mental champions significant milestones of the mental health law. Now we are ready to answer questions from our participants. Joining us in this open forum are the following. We have Dr. Shirley Domingo from the Philippine Health Insurance Corporation. We also have Assistant Secretary Maria Teresita Cueco of the Department of Labor and Employment. And this afternoon, she shall be represented by Ms. Jennifer I. Obien. We also have Ma'am Frances Priscilla Cuevas of the Department of Health and Dr. Maria Corazon Dumlao of the Department of Education. Before we start delving into the questions, allow me to present a brief background of our esteemed resource speakers. First of our resource speakers is Dr. Shirley Domingo. She holds the position of Vice President of the Corporate Affairs Group of the Philippine Health Insurance Corporation. As the head of the group, she manages the communication, marketing, international and local engagement, Social Health Insurance Academy, and Action Center of the corporation. Concurrently, she is also the official spokesperson of the 6,700 strong state health insurance, where she acts as the face and the voice of the corporation and the beacon of inspiration. For Dr. Gigi, as they may fondly call her, being PhilHealth's spokesperson is truly a challenging job, but she sincerely believes that her positive outlook in life, her many years in dedicated public service, and her genuine concern of the success of the National Health Insurance Program are among those that motivate her to do the job. Second is Assistant Secretary Maria Teresita Cueco of the DOLE, and she will be represented by Ms. Jennifer I. Obien, Senior Labor and Employment Officer of the Bureau of Working Conditions of the Department of Labor and Employment. We also have Ma'am Frances Priscilla Cuevas. She is a Chief Health Program Officer from the Disease Prevention and Control Bureau of the Department of Health. Currently, she is in charge of the specialty care cluster overseeing mental health, cancer control, and oral health. She has accumulated 33 years in public service as a public health nurse and has been working with the mental health program of the Department of Health since 2016. And last on the roster is Dr. Maria Corazon Dumlao. She is the Chief Health Program Officer of the School Health Division under the Bureau of Learner Support Services of the Department of Education. Currently, she is also the representative of the Department of Education to the Philippine Center for Mental Health Technical Working Group and the co-chair of the DepEd Technical Working Group on Mental Health. As a medical doctor by profession, she has been in the public health sector for 27 years. She earned her master's degree in public health through a scholarship from the University of the Philippines, Manila, her medical degree from St. Louis University, Baguio City, and her bachelor's degree in biology from the Mariano Marcos State University, Ilocos Norte. Ladies and gentlemen, they shall be our resource speakers for this afternoon's open forum. Good afternoon po to all of you, ma'am, and welcome to our open forum for the celebration of the third anniversary of the Mental Health Law. We have here questions from our participants, and I now read the first question. After 3 years, what changes can we see in terms of the implementation of the mental health law? Okay, may I request first Dr. Shirley Domingo from PhilHealth to shed light on this question. Thank you so much.
Hello and good afternoon to all of you sa lahat na nakikinig at manonood dito. Good afternoon po sa inyo. Anyway, after with the passing of that law, I think the most important thing or effect of that law is the heightened awareness to the issue of mental health. The fact that we had to have a law to address all issues of mental health, to provide support not only to the users of the mental health services, but also to those caring for our mental health patients, no? And also even to the providers. The law also provides some provisions for the providers. I think yun ang pinaka-importanteng nangyayari ngayon, that aware na yung mga tao that there is such an issue and that we should address it as a community, as a country. That's very important. And also the fact that it's mandated that we come out with benefits to address this issue. That was a very important part of this law. Thank you.
Thank you very much po. I also invite Ms. Jennifer Obian of the Department of Labor and Employment to please give an answer to the question. Thank you.
Yes, good afternoon po no, sa ating lahat. With the passing of the law, no, malaki po ang naging role ng ating batas sa pagpapa-implement o sa pagpapalaganap po ng mental health, not only in school or not only in communities but also in workplaces. So pagdating po sa workplaces, si Dolly po ang natatap or nabibigyan ng mandato patungkol sa paggawa po. But as to the noted changes po in the field of work, mas dumami po ang mga kumpanya na nakakaalam po or nagkakaroon ng pagpapahalaga po sa ating mental health at the workplace level. So nakikita po no yung level of awareness at the workplace level is really talagang tumataas po, at yan po yung isang noted changes na sa amin po ay nare-replica. Thank you po.
Thank you very much po, ma'am. I also invite Ma'am Frances Priscilla Cuevas to please answer the question. Thank you.
Sorry.
You're on mute po.
Yeah. I think I would like to answer from the point of view of the Secretariat dahil kami po yung Secretariat to the Philippine Council for Mental Health and has been tasked to really ensure that the law is being implemented. And I'd like to point out several things that we have done, particularly in the objectives of the law. And one of the objectives of the law is to ensure that by leadership and governance, and because of that, we have the Philippine Council for Mental Health na organized natin ito. This is an intersectoral group of our principals, no, mga high-level officials from the different government agencies that are there, and our representatives from the civil society, the academe, and the professional organizations. All of these are coming together and is working towards the achievement of the law. I think yun yung isa din sa nagiging result ng batas na ito, because everybody is there already. What I'm trying to say is all of the different government agencies that has real stake, on the implementation of the mental health law are there in the governance level. So hindi po tayo po pwede magsabi na Department of Health lang ang in charge nito, but everybody is there. No, we are now in the process of ensuring that there is an integrated community-based mental health program that are supposed to be found at the level of the community and primary care. No? So dapat integrated siya, seamless, isa ito sa pinaka-objective ng batas, no? For us to be able to establish this comprehensive and integrated delivery of health services at the level from the community. Importante ito dahil sa ngayon, pag titingnan po natin yung services that are available, medyo inverted pa po ang pyramid natin. Ano? So ang nakikita natin, services are found at the level of our specialized hospitals. We are still seeing a lot of patients, seeing treatment and management at the level of the tertiary care. But what we would like to be able to do is that the community are able to do self-care, the community are able to reach out to one another, because it is a very important part of ensuring that talaga namang mental health services are available at all levels. Of course, we also have a very important milestone actually is that we saw is that people are more interested now. No, katulad ng sinabi ni Dr. Gigi, I think the most important thing is people are talking about it. They were trying already to normalize and destigmatize. I hopefully we will be able to reach that point where we are no longer afraid of talking about our mental health issues and concerns, and are able, to reach out immediately. And having said that, we are really promoting for people to understand and to ensure that quality rights of individuals are there. We have rights, particularly our service users have rights, and that we, each and every one of us should be aware of that and should be able to promote that. Of course, marami pa akong sasabihin sana tungkol sa mga ano ba nakikita, pero bibigay ko kay Dr. Dumlao ang next na sagot diyan.
Thank you very much, ma'am, for the very comprehensive answers. And now to give answer on the context of education and the importance of mental health in the educational setting, I invite also Dr. Maria Corazon Dumlao of the Department of Education.
Much have been shared by my colleagues on heightened awareness and strengthening of structures for and systems for effective leadership and governance of mental health. And I think this all led to ensuring a whole of government approach. All GOs, non-government organizations, the private sector have mobilized resources and put in a lot of investments to their plan of actions, so that there are specific activities that will be conducted in the different settings, and that includes the schools, the workplaces, the communities, organizations. And it's really very important that we're getting all the support from public and private mix, public and private sectors. And we have also seen the translation of all of these initiatives into specific action plans. So all agencies are mandated to come up with their own plan of actions, and it is cascaded to all the different levels of governance. we also have seen that stigma is being addressed. So if social stigma is being addressed, then we are expecting more or improved access to mental health services in the communities. They don't wait for the conditions to become complicated. Even if they have initial signs and symptoms, then they already get access to health care providers. So we can see that mental health is being addressed from the prevention side to the treatment and maintenance side. Thank you.
Thank you very much, Dr. Dumlao. Una pa lang po yan sa napakaraming tanong para sa atin ngayon, and masyado na po tayong nakakakuha ng napaka-comprehensive and detailed answers. So I think this is going to be a very engaging open forum po. Thank you. And I now read the second question for the four of you again po. And the question reads, did people with mental health conditions benefit as expected from the Mental Health Act? Again, Ma'am Dumlao, mauna na po kayo siguro.
Yes, because of all of this translation of plans into specific activities, because of the strengthening of the referral system with a decrease in social stigma and heightened awareness, there's a better identification and referral of cases. People are also getting access to services. They don't wait for their conditions to be complicated. If they can feel that there's something wrong because of the heightened awareness on mental health, then they get access to services. And also they are aware on how they will utilize the PhilHealth benefits and the different resources in their specific settings.
Thank you very much. Now we get to the reverse order. I now call Ma'am Frances Presiles Cuevas, please.
Do people benefit? Tatanungin ko sana. Sabihin ko sana, well, that is not for me to say, pero bigla akong naalala. I think they do, no? Dahil naalala ko yung sinabi ni Dr. Argosa, and even on the reports that they have been providing us, when we first started with the hotline, ko konti lang talaga ang gumagamit ng mga hotlines, but since then and even before the pandemic, actually, no, medyo makyat na talaga din ng mga taong tumatawag na, and because of the law itself, mas nabigyan ng diin na dapat magkaroon tayo ng hotline kasi nandoon talaga siya sa batas, and that is a very tangible way of saying, did it benefit? Yes, it did, because the setting up of the hotline in CMH is something that we cannot take out, and that is something that we were able to really strengthen, and because of the mandate of the law. And tamang-tama lang nang when the pandemic struck, it's already in place, although of course medyo marami pang mga inaayos na ginagawa, but what was able to really help a lot of people. And I also remember that there are people who would approach us, me particularly, for example, and then say, saan ako po pwedeng where can I be referred? Siguro nakikita nila yung Department of Health is working on mental health, and thus they take effort really to reach out so that they can be helped. I think the advocacy, the promotion that we have, that there are services that are available because we are now mandated by the Mental Health Act, mas persado na at mas malakas na yung advocacy natin for services to be accessed. Kaya maraming mga tao na rin ang nakakaalam at maraming mga tao na rin ang nag-avail. So yes, I think I can say that did people benefit? Yes, they did.
Thank you very much po. And to expound the foregoing premises, sa context naman po ng workplace, I call in Miss Jenny Obian, please.
Yes, no, ano po. We do believe also, no, ano po, with the efforts and the initiatives na ginagawa po ng lahat to promote mental health and also madala po yung services natin, no, at hindi lang po yung sinabi nga po kanina ni Ma'am Priscilla that the services is nasa pyramid type pa po tayo. So, yung unti-unti po natin na ginagawa yung mga efforts natin, yung initiatives natin to really bring down the services would really impact po yung or magbe-benefit po yung mga persons with mental health conditions. Also, masasabi din po namin na there is an indirect and direct benefit from those individuals with mental health conditions. So, honestly po kami, wala pa pong data with those persons na meron pong mental health conditions at the workplace level. But then, we can say na merong improvement or nagbe-benefit sila because when they call us, nire-refer namin sila doon sa ating mga mental health providers, we refer them to NCMH, we refer them to DOH, and we believe na nakakatanggap sila ng serbisyo from those agencies. And because of that linkages, partnership, and everything na po na ginagawa ng lahat ng ahensyang involved po sa pagpo-promote ng mental health, we do believe na meron pong benepisyo para po sa ating mga kapwa Pilipino po na merong problema sa pag-iisip or meron pong mental health conditions. Thank you.
Thank you very much, ma'am. I also invite Dr. Shirley Domingo of the PhilHealth to please answer the question.
Okay, thank you. I'm sure this Mental Health Act benefited some those people with mental health issues because of the provisions of the law. Hindi ko lang masagot directly, no? But currently kasi, PhilHealth has a benefit for mental health for hospitalization needs of those with acute attacks of mental and behavioral disorders. So meron kaming ganyang benefit. And so far, from 2019 to 2021 to this year, based on our data, may nakuha kaming mga 30,000 plus claims of this type, and we spent already around 235 plus million for these types of the hospitalization needs. So unfortunately, hindi ko nakuha yung mga details. Was it rising compared to prior to the passage of this law? Maybe that would be a good study, no? Hindi ko lang nakuha yung data yan ngayon. But I'm sure that amount of 235 million shows that people are utilizing this benefit.
Thank you very much, ma'am. And we are now going to proceed to our third question. And this question is still going to be answered by the four of you po. And mauna ka na po, ma'am Shirley Domingo. The question is, what are we doing to make sure that the mental health of the Filipino people is safeguarded in the different settings, like schools, communities, workplaces, and health facilities amidst the COVID-19 pandemic?
Okay, I can answer only for the hospitals, and hayaan ko na yung schools dun sa ating representative from DEX. Anyway, as I said earlier, meron na tayong hospitalization benefits for mental and behavioral disorders, no? And aside from that, we're working on a benefit. We will be launching, actually, national launching. We did this already on a pilot basis, yung tinatawag namin Consulta. Consulta is providing primary care services to every Filipino. Sa lahat, it will be offered to all, no? So, anong relationship nito dun sa ating mental health? We are working closely with the Department of Health to include mental health services into the Consulta. Right now, kasi the Consulta that's about to be launched includes diagnostics, medicines, and services, consultative services for disorders or diseases such as hypertension, diabetes, and the like, cardiovascular. Pero we're working on including mental health into this Consulta package. That means that it will now be available at the community level because this is for primary care. And therefore, the services will not only be in tertiary specialized hospitals, but should be also available through our consulta providers. So I think that so that's in behalf of PhilHealth. Thank you.
Thank you very much po. Since you gave answers on the perspective of health, I call in Miss Frances Priscilla Cuevas to complement po your answers. Thank you.
Yeah, I'm glad to hear from Dr. Gigi that it's going to be included already because we have been working with them in this regard, and I hope that it's going to be soon talaga. But in terms of safeguarding mental health, no, amidst the pandemic, one of the provisions of the law, no, in order to safeguard the rights of people with mental health conditions, regardless of whether there's a pandemic or not, it is really, setting up the guidelines on the IRB, the Internal Review Board. The Internal Review Board is supposed to be established in various mental health facilities, so that when people get into the system or the hospitals where they are being admitted, then they are going to be admitted there and they are not going to be abused because they have mental health conditions. So may mga guidelines po na na-develop para dyan. The overall, this is still on a pilot basis sa ngayon, but the rollout of this will be in the first quarter of the year next year. So all over the country, lahat po ng mga mental health facilities should be able already to have this internal review board. Another guideline that we have developed and will also be rolling out in the first quarter of the year. As of the moment, it's also being piloted kasi magkasama sila ng internal review board, is the guidelines of informed consent. Informed consent, advance directives, legal representatives of our mental health mga service users natin. Importante po ito because we believe that one of the major ways of managing patients is to ensure that they are part of the treatment. No? Parte sila ng treatment, that they are consenting to the treatment that is being provided for them. That's one of the rights that they have. So may mga guidelines po tayo. These are safeguards, there are standards, kailangan pong gawin that when they get into the system, treatment facilities, for example, dapat ay nakapirma sila or nasabihan sila and then na-informed consent. They have consent on what type of services that they are going to get, are they going to be restrained when they are going to have some problems? Are they going to be anong gagawin, anong mga gamot ang gusto nila when they can no longer think for themselves, so may mga advanced directives po sila, and who will be representing them just in case they are unable to make decisions for themselves. So medyo malawak po na mga safeguards and nilagay natin, which is also being outlined in the law, and that we have now all of those and being piloted in all of our in our pilot mental health facilities, and we hope that pag natapos na ito, ang guidelines na ito ay ma-roll out na po natin sa mga lahat ng mga mental health facilities in the country by next year. So nasi-safeguard po sila. But in terms of sa ngayon sa may pandemic, ay meron naman pong safeguard tayo sa lahat. When people get into the system, may mga consent naman yan kung anong dapat gagawin sa kanila and so on and so forth. That's part of the treatment and management when they go to hospitals, to clinics, and even in the communities. No, but this one that I am talking about, this is part of what the law actually is mandating, and this is what we are now trying to put together, and we hope to be able to roll it out soon.
Thank you very much po, Ma'am Cuevas and Miss Domingo from PhilHealth. Dr. Domingo from PhilHealth gave answers on the perspective and context of health facility. Now we want also to hear from our partner in DepEd the impact of the mental health law and how does it safeguard the school setting and the communities it serves. Dr. Corazon, please.
With the passage of the mental health law, it's important for the Department of Education to comply with the law. And it's also important na ma-realize kung ano ba yung commitment doon sa law. So may mga commitment ang Department of Education na kailangan gawin as part of its mandate, yung mental health promotion and raising awareness on mental health issues. So kailangan gumawa ng mga activities upang ma-increase yung mental health promotion. And this complements yung already existing integration of mental health concepts in the curriculum. Meron na tayong integration, and pangalawa na role ng Department of Education is the identification and provision of support and services for individuals at risk. So in that case, kinakailangan din na mag-capacitate tayo ng mga teaching and non-teaching personnel on basic identification ng mga learners at risk para mai-refer kaagad-agad doon sa health authorities or doon sa mga mental health professionals and mabigyan ng guidance counseling services. Kung hindi kaya ng eskwelahan, kinakailangan mag-coordinate sa community, come up with a strong referral system to ensure na mai-refer ng maayos and then mai-integrate din, ma-follow up in the school setting. And pangatlo, it's the facilitating access and including referral mechanisms of individuals with mental health conditions to treatment and psychosocial support. So mahalaga rin yung role ng ating mga trained mental health professionals, yung ating mga medical doctors, nurses, health professionals in the Department of Education to also support yung pag-provide ng health services. Again, at the different levels of governance, mahalaga rin na magawa yung mga policy issuances that would protect yung rights ng ating mga learners at maprotektahan din yung kanilang rights to a healthy and healthy, drug-free school environment at makapagbigay din ng positive school climate doon sa ating eskwelahan. Now, what we're doing now is the implementation of a comprehensive approach to school health by implementing the Oplan Kalusugan sa DepEd. Ito po yung convergence ng lahat ng health and nutrition programs kasi hindi naman po nakahiwalay ang mental health sa physical health. So yung flagship programs po ng department, kasama dyan yung school-based feeding program, National Drug Education Program, Adolescent Reproductive Health. We also have the medical, dental, nursing services, and also yung adolescent health. So, and wash in schools, kasama rin po yan. So, kinakailangan na buo yung ma-implement na programa doon sa eskwelahan. At meron din tayong mga child protection policies, may child protection office din tayo na sumusuporta rin sa rights ng child. At may mga partnerships din po tayo with the community sa barangay for referral of cases and providing additional support. Importante rin po yung school-based management. Kailangan yung principal alam niya kung paano paandarin din yung health and nutrition dahil siya rin po yung nag-lead in light of school-based management. So kasama ang mental health dito sa comprehensive school health and nutrition program. So bawat level ng governance meron pong roles and responsibilities, and integration is the key. Kailangan naka-integrate ang mental health sa overall wellness din ng ating mga wellness framework ng ating mga teaching and non-teaching personnel. Thank you po.
Thank you very much po. We also would like to hear from our partners in the Department of Labor and Employment. Ma'am Jennifer Obiad, please.
Yes, no. Kagaya rin po ng ibang ahensya ng gobyerno, sa ating pong RA 11036 o yung ating pong Mental Health Act, nabigyan din po ng responsibilidad si DOLE na ma-promote at ma-cascade po ang mental health at the workplace level. So at that time, kami po ay naatasan na gumawa ng guidelines na siyang ipapatupad po sa ating mga workplaces that would ensure surely na mapoproteksyonan po yung mental health ng ating mga manggagawa. So in that guidelines that we have issued, we have mentioned there, or we have a provisions there na there should be a raised awareness at the workplace level of promoting mental health at the workplace level. At least the basic information about mental health will be provided to our workers, as well as makapacitate din yung ating mga key frontliners at the workplace level. So sino po ba ito? Sila po yung ating mga OSH personnel at HR people na mag-handle ng cases at the workplace level. So second, na part po ng ating guidelines na in-issue that would ensure or that would safeguard the mental health of our workers is that meron pong correction of stigma and discrimination programs na nire-require pong ma-develop at the workplace level. Third, there should also be an access to services na kailangang maibigay din po sa ating mga workers. Not only those with presenting mental health conditions or mental health concerns, but they should also have programs that would also promote the whole well-being of other employees para hindi na po sila makarating doon sa estado na magkakaroon pa po ng problema o magkakaroon pa po ng mental health concerns. And then lastly, kung wala po sa kapasidad ng isang kumpanya ang magpagamot po ng libre para po sa kanilang mga empleyadong apektado ng mental health conditions or may mental health conditions, they can have referral systems po. So isa po yung magandang mekanismo para ma-address po yung concern, mabigyan ng tamang assessment at interventions ang ating mga workers presenting mental health issues. And aside from that, meron po rin naman tayong mga ginagawang collaborative efforts with other NGAs or other government agencies like the IATAP din po that DOLE is a member. So lahat po doon na isasama po sa usapin ang patungkol po sa pagpo-promote ng mental health. So we continually issue advisories and guidelines and memorandum para po ma-promote ang mental health. At the same time, kami po ay patuloy na gumagawa po ng mga learning sessions po sa ating mga stakeholders to really cascade what the guidelines is and also to emphasize that mental health is a responsibility of everybody, not only DOLE, not only DOH, not only PhilHealth, but everybody is concerned about promoting mental health and taking care of our mental health. Thank you. So yun lang po.
Thank you very much po, Ma'am Jenny Obian. With the answers given by our resource speakers in question number 3, we are all assured that all government agencies are doing their own shares in ensuring that mental health is safeguarded anywhere. And we are all assured too that these efforts corroborate and collaborate with each other. Thank you very much. Now I would like to ask the fourth question addressed to the Department of Health, Ma'am Frances. As referenced by Senator Hontiveros in her recorded message, how can the Department of Health be able to have available mental health medicine that is affordable if not free? This is a question by Mr. Red Mendoza from Manila Times.
Okay, yeah, thank you for that question. And I think it's a very important question because if there are going to be, people have been asking me, what do you think would be the best way of showing whether you have services or not? I think the best way of showing that, at least at this point in time, is the fact that when people are diagnosed with mental health conditions, particularly at the level of primary care, they are also being provided with medications. Kasi importante po yung medications para po sa pagpatuloy na pagpapagaling ng isang pasyente. No? Of course, there are other psycho-interventions that can be done. Ano? But at this point in time, siguro, ang while we are setting other psychotherapeutic interventions, no? I think the provision of drugs and medicines is the most tangible way of saying that we are providing services. How can we do that? Well, as the tinuran din ito ni Congresswoman Kimbo earlier, the provision of budget for us at this point in time, since a few years back, 2-3 years ago, ay medyo kukonti lang talaga, and it is only covering at least 10% or even less than the 10% of the needs of our patients in our access sites. All over the country, no, nakita niyo siguro yung video kanina, nagsasabi na mayroong 207 access sites po tayo sa bansa. At the last count po, yung pinadalhan namin ng mga gamot ngayon, which secured for 2021, it's already 281. So ngayon ko lang din alam na medyo mas dumami na sila yung mga access sites natin. But that's our goal, because we wanted to have more before the end of the year and next year. So how can we do that? And then we ask for more budget, and hopefully the congressmen and the senators who were here kanina, they will champion. And we medyo malaki po yung hiningi po natin for 2022, and we hope that they would be able to push for it. No, our congressmen and our senators who were here earlier would be able to say and really push for na mas malaki po yung budget natin for that. However, having said that also, because of the Mandanas ruling and everything, and the universal healthcare, we're working towards the development of a PhilHealth benefit package. And I think forte nila Dr. Domingo yan, Dr. Gigi. And kanina nagsabi siya na sa konsulta package, and we hope that kung meron sa konsulta package, at least a certain portion of that can be provided, but we are hoping to really have a singular a package talaga, really very specific for mental health. And we have been working on this already, and we hope to have this completed, yung mga processes, so that the PhilHealth would be able to probably approve them, pero medyo kailangan pa ng pag-aaral. So if it's in the consulta package, then maganda yan, because it can be assured na may mga gamot sila. And then if there's another package for that can be provided at the level of the RHU, and then at the hospital level ay mas malaki po yung pwedeng maibigay, and then at the other levels of care, then we hope to be able to have more funding or financing for patients who would need medications in that regard. But at this point in time, medyo malaki po yung hiningi natin, and we hope that the DBM and Congress is going to give it to us.
Maraming salamat po, Ma'am Cuevas. And for our next question po, this is addressed to PhilHealth, Dr. Shirley Domingo. Why is it that the mental health law does not require HMO to cover mental health-related treatment and hospitalization? If a medical doctor recommends treatment or a patient needs hospitalization, why will HMO not cover? Thank you. Ma'am, you're on mute po.
Okay, the question is, why does the HMO not cover? Why does the law not ask direct the HMO to cover hospitalization needs of mental health patients? Right? That was the question?
Yes, po, ma'am. Definitely.
Okay.
Po.
Well, I'm sorry. I think that question should be directed at the authors of the law. Tayo ay sumusunod lang dun sa nakasaad sa law. So maybe that can be included in other legislation about HMOs. Diba? Then maybe the Department of Health can push for that. Right now, PhilHealth covers, as I said earlier, hospitalization needs of acute attacks of mental and behavioral disorders. So we do that. Yung pagpasok na lang sa ating primary care benefit, consulta, which later on will evolve into the comprehensive outpatient benefit package. Doon sa outpatient benefit package, comprehensive outpatient benefit package ay kasama na doon yung konsulta sa ating mga espesyalista. Kasi doon sa konsulta package, primary care providers pa lang yun. So we will include already consultations to medical specialists, including mental health specialists, when we expand consulta into our comprehensive outpatient benefit package. Thank you.
Maraming salamat po, ma'am. Our next question is addressed to the Department of Labor and Employment. Ms. Jennifer Obian. The question reads, how will we ensure that all companies are following the mental health workplace guidelines and standards po?
Yes, as I've mentioned kanina po, no, we have issued our guidelines, and as our mandate, we have these enforcement activities. So we ensure that the companies are complying with the guidelines that we have issued is through the inspection of companies, na sila po ba ay sumusunod kung ano po yung nakasaad po dun sa ating issued guidelines. So in a yearly activity of the department, and since the issuance of the guidelines, or yung aming pong Department Order 208, is that we already included it in our inspection activities. So that is our way of ensuring that the companies are strictly following to our guidelines po. And if there are cases po na nakita namin during our inspection activities, kung hindi pa man po nakaka-comply or nakakasunod po yung company, we gave them an technical assistance on how do we do about, or how do we go about with their company mental health policy and program. So it is truly our enforcement activities or inspection activities. We do monitor compliances of the company. And marami naman po so far ang nakakasunod or nagpo-comply po with our guidelines. So yun lang po. Thank you.
Thank you very much po, ma'am. Next question is addressed to the Department of Education po, and Dr. Maria Corazon Dumlao. The question is, what has the DepEd done for students during the COVID-19 pandemic with the rising need to address mental health problems po?
Ganda po ng tanong na yan. And overall, sections specific to mental health are also included in the DepEd Order number 14 series of 2020, or the guidelines on the required health standards in basic education offices and schools. And as to mental health and psychosocial support during the COVID-19 health emergency, given that the situation is a national emergency, the Disaster Risk Reduction Management Service has led the coordination or conduct of virtual activities on mental health and psychosocial support, including online trainings on the provision of remote psychological first aid. And some of the issuances related to mental health and psychosocial support are as follows. Nagkaroon tayo ng DepEd Task Force COVID-19 memo number 82, yun yung mental health and psychosocial support services for learners, parents, and DepEd personnel, and printing of MHPSS materials. Nagkaroon din tayo ng issuance for DTFC 19 memo number 98, yung new schedule and additional guidelines on the conduct of mental health and psychosocial support services for the opening of classes school year 2020-2021, and also an issuance memo number 109, yung release and printing of the remote psychosocial support through play for elementary learners, a teacher's activity guide and resource package. Pagdating naman po sa curriculum integration and guidance counseling for SY 2020-2021, in terms of the efforts ng curriculum and instruction strand, our OUCI also released policies related to the provision of guidance and counseling to learners, as well as the subject area called homeroom guidance, which covers mental health concepts from K to 12. And may mga issuances din on policy guidelines on the implementation of homeroom guidance during crisis situation, guidelines on the counseling and referral system of learners for SY 2020-21, and yung implementation ng homeroom guidance during crisis situation. For the school mental health during pandemic, yun naman pong ating BLSS School Health Division ay nagko-conduct pa rin ng mga capacity building for our health and nutrition personnel in support of the school mental health program. And we have issued policies to instruct the field to utilize the funds for Oplan Kalusugan sa DepEd, as well as the unexpected learner support program funds for school health programs, including the school mental health program. May mga issuances din tayo on the guidelines para sa pagda-download natin ng mga program support funds to cover implementation of OKD and guidelines on the utilization of unexpended downloaded FY 2019 and 2020 funds para sa ating mga learner support services. In terms of teaching and non-teaching personnel's mental health, syempre mahalaga rin po na meron ding mga activities para sa ating mga teachers kasi indirectly yun naman mga learners natin ang nagbe-benefit. The BHROD has integrated mental health promotion in the overall wellness program and meron ding mga capacity building activities and health promotion. So napakarami po nating support for mental health in the Department of Education amidst the pandemic po.
Thank you very much po, ma'am. And we are very blessed and glad to hear from you the initiatives of the Department of Education in protecting the mental health of our students, our future leaders po. Next is a question for PhilHealth po, ma'am, Dr. Shirley Domingo. The question is, do we have any updates on when the mental health benefit package will be available?
I mentioned this earlier na yung aside from our current benefits of hospitalization for acute mental and behavioral disorders, we're hoping that mapasok na natin sa konsulta, especially when konsulta will be expanded to the comprehensive outpatient benefit. So if the question is when, kasi konsulta will be launched nationally this July, pero wala pa yung mental health, hindi pa incorporated yung mental health doon. As I said earlier, it would be for primary care services for diabetes, hypertension, etc. And we will be expanding this maybe around, we'll study parang yung comprehensive outpatient benefit. We'll be studying what services to put into it, including mental health. And siguro the year after, either next year or the year after, we will be finalizing na a comprehensive outpatient benefit package, which will include already mental health.
Thank you very much. Thank you very much po. Thank you very much po, Dr. Shirley Domingo. And that concludes po our open forum, our question and answer portion. But before we let go of our very esteemed and credible speakers, we would like to hear from you po final remarks for this activity or for this celebration. Anything that you would like to say pa po about mental health and how everyone can be assured that their mental health is protected and safeguarded anywhere. I would like to start na po siguro sa Department of Health. Ma'am Presi, please.
Yeah, we are actually excited about the developments of the implementation of the mental health law. This has been something that we have been working on already for the last 3 years. And we hope na we would be able to really get our strategic plan done by 2023. Ang lahat po na pinlano namin to implement the law is already there. Ma-establish na po natin lahat yung ngayon because it will be the parang that's where we are going to already have a more strengthened system that we wanted to put in place. And just would like to say thank you to everyone. This is not just the work of the Department of Health, talaga namang nandyan through thick and thin, sila Jenny, sila Docora, Dumlao, palagi po kami na nagkikita before, and alam ko we have been working so hard in this regard, and we just thank you for everyone, kahit yung lahat ng mga youth groups that said that we're able to talk to us here today, and all the other organizations. You are all part and parcel of the success in the implementation of the Mental Health Act. And isa lang pong masasabi ko, mental health is the work of everyone. It is a concern of everyone. It is not just a concern of the specialist, but it concerns you because you are actually a mental health worker if you are able to help somebody help him, refer him, or refer her to somebody who can help him. So just would like to say thank you to all of you, and see you next year on the 4th.
Thank you very much po, Ma'am Presi. And before I recognize the second speaker to give her final words, I would like to quote one of your striking lines: protecting mental health is a work of everyone. Indeed, we all should share our parts and take responsibility in safeguarding the mental health of the people around us. Once again, we thank you po, Ma'am Presi. And to give also her final remarks, may I call in Dr. Maria Corazon-Dumlao of the Department of Education. And to give her also her words of remarks, her final remarks, I call in Dr. Maria Corazon-Dumlao. Ma'am, you're on mute po.
Nagpapasalamat tayo sa Department of Health for taking the lead in the implementation of the mental health law. At napakaganda po na the structures are already in place. Yung mga key offices in government ay kasama sa Council for Mental Health, and meron na rin po silang mga efforts to ensure na yung mga database, yung mga mental health evidence-based database, at ma-capture din yung mga accomplishment ng bawat agencies ay ma-ensure, and we are really supportive of that. Gusto ko lang po rin ipaalam na meron tayo ngayon napakagandang platform kung saan pwedeng ma-integrate pa at mapa-strengthen ang mental health. Ito yung interagency TWG together with the DOH on the healthy schools. Ito naman ay pag-address natin sa universal health law. And kapag sinabi po kasi nating healthy schools, the policies and activities and implementation of healthy learning institution framework shall be in line with the 6 pillars of the WHO Health Promoting Schools framework. Kasama dyan yung healthy school policies, the physical school environment, the social school environment, health skills and education, links with parents and communities, and access to health services. So this will ensure na mas lalo pang may strengthen yung holistic health and nutrition care and support sa ating mga learners, and also to our teaching and non-teaching personnel. We support the Department of Health in all its initiatives. Thank you po.
Thank you very much po, Dr. Dumlao, for enlightening us with the initiatives and programs of the Department of Education in ensuring that mental health of the students is guarded and protected po. And thank you also for making the schools not only a conducive place for learning, but also a healthy environment for everyone. And now may I also call in Assistant Secretary Cueco through Ms. Jennifer Obien to give her last remarks, please.
Okay, thank you. No, nagulat ako. Kala ko dumating po si ASEC. Anyway, sige po. We at the department po, so we are grateful din po that si Dolly po ay laging napapatawag or napapasama po sa mga event na ganito ni DOH. specifically po on mental health. So as mentioned nga po kanina ni Ma'am Presi, throughout from day one po ng mental health, magkasama na po kami. So again, on the Department of Labor and Employment, we envision that through our issued guidelines, ini-aim po natin na ang lahat po ng mga companies under our mandate, specifically the private sector po, na magkaroon po sila ng polisiya at programa na talagang mag-ensure sa safety and health ng ating pong mga manggagawa, not just only as their physical health, but also their mental health. That there would have activities, that they would have programs that would really look into the mental health of the workers. So sabi nga po natin, feeling healthy at ligtas po yung ating mga manggagawa if they would feel that they are taken care of, or that their employers would look after them. So with that po, the DOLE will continue to support the OH po in this initiative, and we will continue to advocate for mental health at the workplace level. Thank you and good afternoon.
Thank you very much po, Ma'am Jennifer Obien, for letting us know that the DOLE is doing all its best to ensure that the workplace is a safe place for our laborers and for our workers. Maraming salamat po. And last to give her remarks is Dr. Shirley Domingo of the PhilHealth.
Okay, thank you very much. Currently, we are battling the worst health crisis that hit not only the Philippines but the world, and this is our COVID pandemic. However, mental health is also a very important condition that we should look into, because it may have affected, or I'm sure it has affected a lot of people, especially because of pandemic, maybe pandemic proportions also, but it is silent but very important, and therefore we have to take care of our mental health. We in PhilHealth, we provide financing for services. And by providing financing, we ensure that these services are available to those who need it. And when they need it, that they will not be impoverished because PhilHealth is there. So we just want to ensure everyone that we know, we are very much aware of the importance of mental health, of being healthy mentally and physically. And dapat hindi mapabayaan ang ating mental health packages. And we are working on it, especially, as I said, bring it down not only where it is present now, which is in the hospitals, specialty services, but also down to the community level, so that anyone who needs it will be able to avail of it. And so we're making sure that that's available through our packages. As I said, our consulta packages, our soon-to-be comprehensive outpatient benefit packages. So abangan nyo lang po yon, mga kababayan po natin. We are here, PhilHealth is here to make sure that we respond to your every needs, especially mental and not only physical needs. Salamat po.
Thank you very much po, Dr. Shirley Domingo, for your words, for letting us know that PhilHealth is also doing its best to ensure the safety of everyone, both in physical and mental health aspects. And that concludes our open forum and the celebration in general. Once again, we thank our esteemed resource speakers, Ma'am Frances Priscilla Cuevas, Dr. Maria Corazon Dumlao, Ms. Jennifer Obien, and Dr. Shirley Domingo for being with us for almost 2 hours. Thank you very much for sharing your time with us, and to all of our participants in the different platforms, YouTube, Facebook, and in the Zoom link. Thank you po for being with us. This has been a very insightful, engaging, and meaningful activity with you, and it is our fervent hope that with the learnings we get from this very meaningful celebration done virtually, all of us are ensured that our mental health is everyone's priority. Once again, maraming salamat po sa inyong lahat, and we are looking forward to seeing with you again on our next endeavors. Maraming salamat and stay safe.
Thank you.
Thank you.
Thank you po, and good afternoon sa lahat. Stay safe po.
Stay safe too.
Thank you po.
Hi, Chona. Thank you. Bye-bye. Happy anniversary.
Ma'am Presi, salamat po.
Yeah, out na
Ma'am
tayo.
Jenny, opo, you may leave the room na po. Thank you very much po.